So our first presenters are from Oregon Humane Society, their Criminal Investigations Law Enforcement Division. They have a couple of different presentations. One's going to be more along their forensic veterinary side, and then one's going to be more along the lines of their law enforcement capabilities as far as that go. So if you guys want to come up here, whoever's presenting first.
So my name is Veronica Broadway, and I've been at Oregon Humane Society for 8 years. I've been a certified property and evidence specialist for 6 years, and I'm really happy to meet all of you folks that I've talked to or emailed with over time. So thank you.
Morning, everybody. Thank you for having us here at your conference. As I alluded to earlier, my name is Chris Laurie. I work for the Humane Society. I'm the chief of the law enforcement section there. Prior to joining the Humane Society, I was with the Oregon State Police for 26 years. I mainly worked in fish and wildlife enforcement because all the enforcement in Oregon is done by the Oregon State Police primarily. I spent 18 and a half years as a sergeant, so I supervised other troopers. Before joining the Oregon State Police, I worked for the Oregon Department of Fish and Wildlife as a biologist. I got a degree from Oregon State University in fishery science. I am a part-time instructor at PCC up in Portland. I instruct criminal justice classes like fish and wildlife enforcement, introduction to criminal justice. And part of the presentation, if we have time at the very end, that I'll talk about is just a basic criminal investigation that I'll try to cover. So, but first of all, we're going to have Veronica and Dr. Titcomb talk.
Hi everyone, I'm Dr. Maia Titcomb, one of the staff veterinarians at the Oregon Humane Society. I am from New England originally, so I'm sorry if I say wicked every now and then. I moved out here to go to Oregon State for vet school, and just wound up staying because we love Oregon so much. So I've been at the Oregon Humane Society for a few years now. I completed a shelter medicine internship there and then stayed on as a veterinarian full time. So I'm really excited to be here today and meet all of you guys, all of you wonderful people doing wonderful things for animals. I'm excited to talk to you about forensics.
These are what we're going to review with you today. So we're going to launch it off with veterinary forensics because that's fascinating. Talk to you a little bit about our department and our scope of authority, and talk a little bit about evidence processes, and then finish off with criminal investigations. Just switch over to Dr.
All right, hi everyone, how's the volume? Can everyone hear me okay? Yeah? Great. All right, so we're gonna dive into forensics. This is a topic I could talk at you all for days. I'm gonna try to fit everything into 45 minutes. So we'll be kind of doing a little brief overview of everything. What is veterinary forensics? What does this mean? It's kind of a growing field of science that is actually using the expertise of a veterinarian to help collect and then also examine the evidence that's associated with crimes against animals. This is the oath that everyone takes to graduate to become a veterinarian. Back in 2010, this line here was actually added to indicate the protection of animal health and welfare and the prevention and relief of animal suffering. So I think this really speaks to how much this field is growing and how much the field is really starting to recognize this branch of veterinary medicine. So what do we do as vets? Yes, sometimes my job is just puppies and it's wonderful, but it's not always. So a big part of being a veterinarian is recognizing the potential signs that could be associated with abuse and crimes against animals. It's really important to know that as a veterinarian, you do not need to know that a crime occurred to report something. You just have to have a reasonable suspicion based on your exam and your history findings. We try to remember to be suspicious of our findings, but to also be objective. We're not trying to make any assumptions here. We're just going off of the facts of what we see in front of us and then also what we're hearing on the history from the caregiver. A lot of our role is to collaborate with law enforcement, everyone in this room, human healthcare professionals, community members, and social workers, both those who work with humans and then also veterinary social workers who help us a lot with certain more challenging cases. Our medical records are very important to document everything. These are a legal document that can be called into court. We do forensics exams and necropsies, and then we also appear in court as expert testimony if these go to trial. So, animal cruelty, neglect, and abuse, I'm sure everyone knows, but these are kind of used somewhat interchangeably sometimes, and it is kind of a fuzzy line about what is what. In general, I consider animal cruelty to kind of be an umbrella term to encompass neglect and abuse. This makes it very wide, as you all know. It really runs the gamut from intentionally withholding food and water from an animal all the way to maliciously torturing and killing an animal. So it's a very wide range of what we deal with here. So we'll start off with animal neglect here a little bit. Animal neglect at its root is a failure to provide minimum care for an animal. So this means that we are not providing appropriate food, water, shelter, and veterinary care for their survival. So basically, neglect is just not meeting these very basic minimum care standards that an animal needs to survive. This can be deliberate, but it can also be unintentional. So we do see animal neglect cases where the people associated with these animals are also not able to take care of themselves. So this is not always an intentional act. In these animals, very extended periods of neglect often lead to very serious disease, as well as potential death. This neglect is often a very fine line also, so we might see something that's emaciated. We do not jump to the fact that this animal was abused or neglected. It might have an underlying medical condition, so that's part of our role to figure that all out. So, just to speak a little bit more specifically to Oregon laws, in the Oregon law, minimum care is care sufficient to preserve the health and well-being of an animal, included but certainly not limited to these things. So, food, adequate to sustain an appropriate body condition. They have to be able to have potable water. This does not just mean any water source. It needs to be fresh and clean. Access to adequate shelter and ability to get away from the elements. Veterinary care that is deemed prudent and reasonable to keep these animals free of disease and suffering. Adequate space for exercise. This is not only for physical comfort, but also the mental needs of the animal. A suitable temperature. They should be able to be comfortable in their home. Should not have any excess feces or urine built up in the environment. And humane euthanasia is actually included in this, so this kind of extends to our large animal friends. If a cow, a horse, a large animal breaks a leg and they're unable to do anything, these are not really simple surgical fixes like they often are in cats and a dog. So humane euthanasia is actually included in this to preclude that animal from suffering anymore. So some common things that we see for neglect. Emaciation is a really, really common one, and we'll go over some body condition scores in a little bit, but in general, if you can see all of the ribs and you can see all of these bony outcroppings, that is generally an underweight animal. Severely matted fur is also a really common one that we see. This is very uncomfortable. I'm sure we've all had animals who've had a mat or two. We are talking here about very severe matting. This tugs on the animal's skin and is really, really uncomfortable. It prevents them from adequately thermoregulating and maintaining appropriate temperature. It also means that they can't groom and they're in chronic pain for this. Overgrown nails and hooves are a really, really common one too. In our small animal friends, these can actually grow so long that they loop back around and embed in the skin, causing pain and infection. Livestock, this can preclude them from even walking normally at all. Severe flea, tick, and parasite infestations are also included in neglect if they are left untreated. This little puppy up here, you can see he's got a little pocket underneath his jaw. This was a puppy that had such severe intestinal parasites. They were basically consuming all of his proteins and all of his nutrients. So his body had nothing left to keep all the fluid where it needs to be kept. So then you can see it kind of pocketing in gravity-dependent areas like that. Embedded collars, unfortunately, are a very sad thing that we see too. So this is an animal that either a collar was put on as a puppy and they grew and it was never fixed or left tethered for too long. They embed in the skin and cause very, very painful chronic wounds. And then urine and fecal matting also and skull. So this little dog down here came to us. I wish I could put a smell in a photo. That is all feces just matted into his fur. It was awful. So he needed about 1 to 2 hours of anesthesia to clean him up and get all this off of his body, and not a good time for him. So I'm very much a small animal vet, but I want to just throw a few large animal things in here. This cow here, you can see is pretty underweight. So you can see every one of his ribs very, very clearly. And then this over the tail base, that should be kind of a nice rounded curvature that's very sunken, and you can see all the little edges of his bones. And then horses and overgrown hooves, you can see this is a very extreme example. But this guy up there has markedly overgrown hooves. And that photo right there is a really nice hoof angle. So that's what a nice horse hoof should look like. The laws in Oregon, a lot of you already know this, I'm sure. Animal neglect in the second degree is this failure to meet minimum care. First degree is if this results in serious injury or death to the animal. And then I just wanted to speak on the 5 freedoms very quickly. I know that a lot of you have probably heard about this already, but this is something for me that I keep returning to. I think it's a very useful thing. This applies to us, but it applies to all these animals too. So these are basically things that every animal has a right to. This was established in the UK in the 1960s or 70s in response to some livestock laws. These are basically everything that an animal is entitled to. They should never feel hunger or thirst. They should always have access to fresh water and food. They should be free from discomfort, so they should be able to have an appropriate environment, shelter, a comfortable place to rest. They should never feel pain, injury, or disease. So this is not only preventive care with a veterinarian, but rapid diagnosis and treatment of diseases, so they're not stuck suffering. Freedom to express normal behavior. So this means space to exercise, to be free, company of their own species if they want it and enjoy it. And then freedom from fear and distress. So this is kind of the behavioral side of things. They should never feel like they aren't mentally suffering. So now we'll go into kind of some more right of use. These are sometimes more obvious, but sometimes more subtle too. So, more obvious things here, are they unable to stand or walk normally? This might speak to severe weakness from severe neglect, or this might speak to an orthopedic trauma. One of our big red flags is wounds in various stages of healing. So this kind of speaks to chronic repetitive injury. So we'll look at the different wounds and see at what point they're healing. Facial asymmetry might tell us about a skull fracture, so some type of blunt force trauma. Broken teeth and wounds inside of the mouth. Broken teeth can be from blunt trauma, but also chronic malnutrition if these animals are chewing on rocks and other hard objects trying to get any nutrients into them. Burns are a pretty obvious one. This cat here is actually one that came to us that wound up not being a criminal event, but a good Samaritan found him and thought that he was burned by someone, which is very reasonable to think that. Bleeding within the eye is another really big one that we look at. So if they're bleeding within their globe or around their globe, it can tell us that they've sustained trauma of some type. And the last 3 here are things that the veterinary professional community just kind of keeps an eye out for. So if we're hearing a certain history from this animal's caregiver and it's not really matching with the physical exam findings, that's kind of something that's setting off a little bit of a flag in our head and saying, that doesn't really fit together. The owner may be unwilling to discuss details, so when pressed about something, they might kind of get a little bit cagey. And the owner might have a kind of unusual relationship with the pet. So you might notice if an owner comes back into a room or something, that the pet kind of tenses up a little bit. So watching these little interactions between the pet and the owner can be really helpful too. Again, the animal abuse laws in Oregon range a lot here, but you can see that the common thread is intent. So this is really, I'm not gonna read this all yet. Summary slide. So, animal hoarding also is something that we could talk on all day. I won't do that to you. The general definition of animal hoarding is that you have more than the typical number of companion animals and you are unable to provide appropriate care for them. Again, this is a form of neglect when you're failing to meet the minimum standards of care. This neglect in these hoarding situations often results in severe illness and potentially death. This can be from chronic malnutrition, infectious disease that's running rampant in the hoarding home, and then untreated medical conditions. Another important aspect of hoarding is the denial of this ability to provide, this inability to provide minimum care for these animals. It also has an impact on everyone else in the home. And then the other really important part of this is a persistence in continuing to accumulate animals despite this inability to meet minimum care for them. It's a really complex issue. And one thing that we look at in these cases are they seeking help? We've had people approach us and ask for help. You may have heard Oregon Humane Society over this past year took in over 250 guinea pigs. It was very cute, but it was a lot of guinea pigs. So that was from a hoarding house that someone actually approached us and asked for help. In the vast majority of these cases, there are dead or severely diseased animals found in these homes. While hoarding is usually small animals, usually cats and dogs, you certainly can also hoard large animals, exotic animals, birds. Nothing is really off limits for hoarders. It generally tends to be cats over dogs. This might just be an easier thing to accumulate due to their small size and not as loud as dogs. One thing that everyone in this room knows, but it's really important to reiterate, is that hoarding does not mean that you are a shelter or a rescue. Shelters and rescues take care of their animals. You all know this. I think that's a very important thing to reiterate to everyone. While the Oregon laws don't really specifically say what is a hoarder, there are some interesting laws regarding dog breeders. So dog breeders are actually not allowed to have more than 50 intact animals at any point in time. And if you're over, I believe, 10 intact animals, you do need to actually have full documentation for all these animals. So that's kind of one way to keep an eye on things. For more information, if anyone is interested, Tufts University, the School of Veterinary Medicine there, actually has this really great research consortium on hoarders. So they have a lot of good resources posted on their website, and they have a lot of really good information. All right, let's dive in. The forensics exam. So we might be called as veterinarians to do exams on any number of cases. So we have a live individual case. This is usually neglect or abuse. We have live large-scale cases. So these are the hoarders. We might see puppy mill cases, fighting rings. And then we are often asked sometimes to do deceased animal exams as well, which is a forensic necropsy. So overall, like I said before, one of the big things that we look for is repetitive injuries. So this means that we might look for chest radiographs to look for if we have rib fractures at different stages of healing. We might see if we've got wounds at different stages of healing. That's a big red flag for us. Young animals in general are more likely to be abused, generally under 2 years old. This is multifactorial. A lot of it could just be due to behavior. They're much more energetic. Having said that, we do need to keep an eye out for our little geriatric animals too. Sometimes those can be really frustrating for people. Maybe they're not listening as much because they're losing their hearing. Maybe they're urinating or defecating in the home because they're losing control of that. So I do think we need to keep a close eye on our old friends too. In general, for dogs, male dogs tend to be abused more often than female dogs. And the most represented breeds in these cases are mixed breed dogs and then also pit bull style terriers. Cats are some of the hardest things to read about, truly. Cats sustain generally the widest range of abuse. They are really fall victim to horde abuses. Feline cruelty is most likely underrepresented. I believe that we do not see the full scope of what cruelty is inflicted towards cats. Again, this is multifactorial. A lot of people, if their dog is missing, they will certainly look for their dog. If their cat is missing, they might say, I don't know, they ran off, maybe they got eaten by something. So we may not be able to fully find every cat. Cat injuries are also more likely to end in death. They just are smaller, they can sustain a lot less trauma, and they are often sustaining worse trauma. This is a really interesting study that came out from Tufts University recently, looking at motor vehicle accidents, so MVA versus non-accidental injury. And while this is certainly not a hard and fast rule, it's kind of a useful guide to see where our injuries are and kind of see if the story fits with things. So this one here on the left is generally what we see in car accidents. So we'll see a lot of hind end fractures, we'll see a lot of femur fractures, the back leg, and then pelvic fractures. And then generally the trauma that we see in the chest is a pneumothorax, which is air in the chest that shouldn't be there and precludes the lungs from expanding. And then pulmonary contusions, which essentially means that the lungs get bruised. We can also see a lot of degloving injuries, which is where the skin is actually pulled up from the underlying tissue. And then abrasions, so road rash. Over here, on the other side, we have what is generally seen in non-accidental injury. So our fractures are mainly seen in different places. We'll see a lot of rib fractures. Ribs fracture very easily and they take a very long time to heal, so it's something that we see pretty commonly. We'll see a lot of oral fractures in the teeth. We see skull fractures, and then fractures along the vertebral column as well. And again, older fractures, which is the importance of taking x-rays or radiographs to kind of check out and look for these and see if they're hiding anywhere. Scleral hemorrhage is kind of what I was talking about earlier too, which is blood in the eye. That can be a big thing. Damage to claws, we'll talk about a little bit later too, but we can see looking at the paws is really, really important. It can tell us a lot about the potential injury. So, any exam kind of starts from the outside, so we take a peek at the animal from a distance first. We'll take a look at their weight, their hydration, we take a TPR, which stands for temperature, pulse, and respiration rate. Elevations or decreases in any of those values can kind of tell us some valuable information about what they're going through. We look at their body condition and their coat quality. So are they missing hair anywhere? Do they have wounds? Their posture and ability to ambulate. Are they arched? Are they protecting something? Do they seem like they're hiding pain from me someplace? Are they able to walk? The level of consciousness can tell us a lot too. So are they dull? Are they untended? Are they completely unresponsive? Are they hyper and really all over the place and seem really, really anxious? We also look at their behavior and their human interactions. I look at if they are nervous when a new person comes into a room. I'm seeing how they respond to touch. Are they anxious? Are they flinching away from me? And then any abnormal sounds and smells are really important too. What does the animal smell like? Do they have feces on them? Do they smell like any fumes? Do they smell like smoke? Abnormal sounds, this not only means me listening with a stethoscope, but anything else from the animal. Are they trying to bark and they're unable to bark? Then a really important one, especially in our emaciation cases, is response to food. So we'll get these animals in sometimes that are so skinny, and the caregiver might say, I don't know, she just stopped eating, she doesn't want to eat anymore. We offer her food and she's ravenously eating it and focus on it for the entire exam. So if you have a case like this, it's really important to get video of them eating that food, because that can be really, really important to prove that this animal was really, really hungry and that food is being withheld. So this is Ashton here, a very sweet old lady husky. So this is just kind of some other things in addition to a regular physical exam that I'll do that kind of speak a little bit more to a forensics exam. We'll do our eye exam, look for symmetry of the face. Does she have any injuries in her mouth? Any tooth fractures? Overall, we'll look for her BCS, which is her body condition score, and I'll go over some helpful guides for that in a minute. Scan for a microchip. This is often a really easy way to find someone associated with this animal. And we'll do a pain assessment, so I'll talk a little bit more about that too. And then again, super important to focus on the paws. So are the nails frayed? That might indicate a dragging injury, that they were pulled out of a situation. Is there any trauma to their paw pads? That can not only show us trauma of dragging, but also if they were on a hot surface for too long. We can see frostbite on their toes if they're left outside. Their nail length, is it overgrown? Is it looping back into their skin? And almost as important is the lack of findings. This is what we mean when we say we document negative findings. Sometimes we don't find anything, and it might help us determine that that doesn't fit the story of what we're seeing. This is maybe hard to read because there's a lot happening, but you can look this up online. So all the major food companies generally have this body condition score. For small animals, we generally score it from 1 to 9. So 1 is severely emaciated, 9 is very obese. 4 to 5 in general is a nice, ideal, lean body weight. So this is for dogs and cats. And if you find this online, it's really nice just to have this kind of pictorial evidence. You can see for the body score of 1, you can see all of the ribs, and looking down on them, they're very, very tucked and very skinny along there. And then all the way up to number 9, they have a lot of fat deposits. We can't even feel ribs. So this is a really, really helpful guide to have. It's a way to it's still kind of subjective, but it's a way to somewhat quantify body condition. Okay, and then pain. So assessing pain is part of any veterinary examination, forensics or not. It's really hard because animals like to hide things from us. And in general, bringing this into an abuse case can be really, really challenging. It's really hard to quantify pain, and it's hard to communicate what these animals are feeling. So what we have to do is learn how to speak their language and kind of read what they're telling us through their little subtle cues. So I'll look at, is there situational evidence that there's pain around? And am I seeing any altered behavioral responses that suggest pain? And am I seeing any physiologic changes on my exam that suggest pain? A few things that you might see if you're looking at a dog, increased heart rate, respiratory rate, and blood pressure are all really, really common to see in painful animals. While these can be due to other causes, they're all part of the body's compensatory mechanisms to deal with pain management, so these can all be valuable things to see. Animals might guard their painful areas, so you might see them kind of protecting their abdomen if they're having belly pain. They might also lick or chew painful areas, which sounds kind of counterintuitive, but it's kind of a mechanism to kind of distract them from that pain. You might see them vocalizing, and they might not be grooming as much or excessively. Cats are notorious for not telling us anything about what they're feeling. They're really, really hard to assess pain in. The big one for cats is hiding. Painful cats generally like to just find a hiding spot and not interact with their people as much. That's a really big red flag for pain in cats. They might growl, they might hiss if they're painful. Also kind of counterintuitive is that painful cats sometimes purr. We associate purring with a really happy cat, but this can be kind of a self-soothing mechanism sometimes too if they're painful. And then another really good resource is kind of a recent study that came out called the Feeling Grimace Scale. So it's some new research looking at how cat facial expressions correlate with pain. So one thing that they did find is that a cat with kind of squinted eyes and pinned back ears could very well be a painful cat. Dogs are sometimes a little bit easier to read them for pain, but still kind of a challenge. Dogs might be kind of restless, they'll lay down, they'll get back up, they're kind of unable to get comfortable anywhere. They might kind of be more timid and shut down, or they might be acting a little bit more aggressive if they're painful, and that's their defense mechanism. All right, and then when the animal is no longer alive, then we're at a forensic necropsy. So we do necropsies a lot as veterinarians. They're very, very helpful. We can learn from cases and understand what went wrong. The difference in a forensics necropsy is really the objectives and the relevance. So we're trying to determine what we think killed this animal, how it died, was it accidental or non-accidental, or due to an underlying disease process. Rough time of death, this is very, very hard depending on when you do the necropsy, and then any contributing factors. So we document all positive and negative findings, meaning we document everything that we found or didn't find on our necropsy. Photos, on the external exam, we'll scan for a microchip, confirm sex of the animal, look for any rigor or lividity, which we'll go into in the next slide, decomposition, and any smells that we might see. After we take photos and do our external examination, it can be really helpful to shave the entire body. As you know, these creatures are covered in fur, and so shaving off all the fur can let us see kind of some smaller wounds that maybe didn't bleed out to the outer layers, and any bruising that's happening. During our necropsy, we'll take different sample collections. Every vet kind of has a different way that they go through a necropsy, but we tend to all kind of stick to a pattern to make sure we get everything. Hemorrhage, in general, if you see this, so hemorrhage is bleeding into something, into a tissue or a body cavity, that is a pre-death injury. So hemorrhage always happens when the heart is still beating. As much as necropsies can tell us, there are a lot of limitations. So we've all seen Law and Order, and I would love to be able to send off a blood panel and tell why a dog died, but toxicology testing is often really, really expensive and can be kind of low yield. So that is something that we kind of do very, very carefully. Decomposition is another thing that is kind of a challenge sometimes with determining things from a necropsy. So soft tissue injuries, if the animal's kind of decomposed too much, we might not be able to tell anything about it. So a few changes you might see. Livor mortis, or lividity. This is pooling of blood in dependent body sites. This is pooling in blood vessels after the heart has stopped beating. This is also called lividity. You'll see this in gravity-dependent sites, so this can be kind of helpful to see if the body has been moved. If you're seeing this kind of pooling up on the other side, then the body's likely been moved from where they were originally. It can be kind of hard sometimes to know the difference between lividity and bruising, because they can kind of just be like these focal purple collections. So, lividity, in general, this blood is contained in the blood vessels. So if you press on it with your finger, it'll blanch for a minute, so it'll go white temporarily. Bruising is actually blood out of the vessels into the subcutaneous tissues, so that if you press on it, will stay purple. It's kind of a good way to know the difference between those two. Rigor mortis, I think everyone's heard of. This is the muscle contraction after death. ATP is this little energy molecule that is responsible for everything. So after death, this gets depleted and it locks the muscles into a fixed position. So rigor mortis will essentially stay around until decomposition starts to set in. A lot of factors will affect rigor and how fast they go into it. So we actually see if the animal was exerting a lot of energy right before death, so were they struggling, were they exercising, the rigor will set in faster because the muscles are kind of blowing through that energy moment. Allegor mortis is the term for the cooling of the body temperature to the ambient temperature. A lot of factors change this too. An emaciated animal is going to cool down a lot faster than an animal with a lot of fur cover and fat on their body. Decomposition is another thing that's really challenging because it's really variable. It tends to start happening in 6 to 36 hours, but this really is really variable. A lot of things affect this, so a body might decompose faster in kind of humid conditions, and insects are a really important thing. I know it's kind of gross, I'm sorry, but they really accelerate the process because they're in there kind of helping the tissue to break down. So again, if you're out in the field and you see a body, there's some potential things that you might see. So if the death just happened, you're probably not going to be seeing much discoloration, maybe some lividity in the pooling areas. In early decomposition, you might see some fluids coming out of the animal's nose and mouth. These are decomposition fluids. So this is kind of as the organs are breaking down. You might see some discoloration of the body, but maybe not much. You'll see some extremities drying out a little bit. And we actually see the abdominal cavity bloating a little bit. So this is what happens when bacteria kind of head out from the gastrointestinal tract, where they're usually hidden away safely. They kind of leave the gut during decomposition and can kind of cause some gas activity. So the abdomen might be a little bit bloated if they're in early decomposition. When we get to more advanced decomposition, we'll see the soft tissues kind of caving in, they're losing their mass and starting to break down. We see mummification of the surface, so the skin will kind of get that dried out leathery appearance. And then the cavities of the body will start kind of collapsing down as everything's kind of breaking down and they lose fluids. And then skeletonization is kind of self-explanatory. This is when all the soft tissues are totally broken down or in the process of breaking down. The skin will be totally leathery and desiccated. We start seeing bone exposure, and in the final stage, it will just be a skeleton that remains, and the bones will be pretty dry and white. So Veronica's going to go in way more into detail on this, but a few things on evidence collection. Photographs, so important. So we get 6 views. We get an ID slide as well, just where we have the right animal. If you're taking a photo, if we're taking a photo of like a wound on an animal during an exam, say it's on their like side, it's really important to get a context shot and then a detail shot, because if we have just the detail shot, we might be able to tell where that wound is. We like to store things in clean paper bags over plastic. The reason being that paper can breathe, so plastic will trap in moisture and has the potential to damage really valuable evidence. So breathable paper bags are way preferable. And then everything else here is just kind of options to store things in. So if you've got a gun, a little projectile, it might be good to put that in a little cardboard box. A sticky thing you can put in something like wax paper so it's not stuck to it and losing evidence. Coin envelopes, those little paper guys are really helpful for small things. Stains, if you can get the whole stained item, it's really good. If you can't, you can use a little moist swab to collect some of that, or use a scalpel to cut off a piece of fabric or something. The most important thing to remember is that everything is potential evidence. So a collar, a bed, overgrown nails, mats. After we shave the animal free of mats, we save all of those in a paper bag. So everything is potential evidence. And then we'll talk very briefly on transporting a body. So the first thing to remember is that the crime scene kind of starts at the location, right? And that's where the exam starts. So documenting the locations, really important. Is the body in full sun? Is it in a wet area? What's the temperature? How exposed was the body? So these are all really important things to note. This is not vital, but you can put a paper bag over the feet so we don't lose any valuable evidence that's associated with the paws. A plastic bag over the head can be really helpful just for those decomposition fluids that are starting to come out. Then we wrap the body in a clean sheet and put it either in a body bag or a large plastic bag. This is maybe the most important thing on here. Please don't freeze a body. It can mean that we can lose really valuable evidence, and if we need to do histopathology, which is an up-close tissue analysis of an organ that lets us look at the cellular level, that can be totally destroyed with freezing. So refrigerate the body, don't freeze it. And then we maintain the chain of custody too. So, I just wanted to touch on the link. Everyone I think in this room knows this, but animal abuse, it's been very proven that animal abuse can be very reflective of other abuse happening in the home. So elder abuse, abuse of children, and domestic violence. This has been very proven. The link has really good information on this correlation. This is why it is so important in the veterinary field that we recognize abuse and report it. Again, you don't have to prove a crime, you don't have to be sure it's happening, but if you have enough suspicion, it's so vital to report, because it could be indicative of another process happening in the home. Okay, okay, a lot of that is really bleak, so we're gonna end on a happy note. This is Duke, this handsome man, this beautiful pitty boy. Duke came to me on New Year's Eve of last year. Duke was so emaciated that he was unable to walk. He couldn't lift his head up. He was reeled into me on a gurney. He had multiple wounds all over his body, so his tail was covered in wounds, and he had wounds on the side of his trunk. He had just this horrific bloody diarrhea. He was anemic, meaning a low red blood cell count. He was hypothermic and unable to get his temperature up because he was so thin, and he had some broken teeth as well. The wounds on the tail is something that's really important to keep an eye out for too, so especially in these pit bull breeds with very little fur covering their tail. If they're whacking their tail against a little confined space for a long period of time, it can lead to wounds in the tail. In the shelter, we call it happy tail, because usually wagging their tail so much in their kennel, but that can be really indicative of something more happening. So, Duke is a full-size pit bull. He came to us at 30 pounds. This is him on intake. You can see on this photo, he's completely lost all of that nice fat and muscle coverage up at the top of his head there. It's really shrunken in. He was unable to keep his head up without us holding it up for him. We hospitalized Duke on IV fluids, antibiotics, pain medications, support drugs for his gastrointestinal tract, and a refeeding plan. So a refeeding plan is something that we use for emaciated animals. If an animal has gone for a very long period of time without any food, and then suddenly just gorge themselves, it can essentially result in a life-threatening electrolyte imbalance. So we make a little refeeding plan for these guys. It's the hardest thing in the world not to just feed them everything that they want right away because they're starving. But we basically calculate their daily caloric needs and start off with a fraction of that, and then we feed them a little bit more every day and kind of work their body back up to getting used to having food in it again. After that, they get to eat whatever they want. That's the best part of it. So Duke was hospitalized for a while. He steadily started gaining weight, getting his mobility back. We remember the first time he walked up a hill without sitting down. We were like, yay, Duke! He spent weeks in foster care, just kind of porking back up and becoming a beautiful pit bull boy again. His procedures included we did actually have to partially amputate his tail due to the extensive wounds that were kind of traveling up his skin, so he's got a little nub now. He needed dental surgery to extract his broken teeth. His broken teeth could have been from being confined, but also could have been from chewing on objects that he shouldn't have been chewing on because he was so hungry. And then an interesting thing that we found for him is that he was actually heartworm positive as well. Heartworm is something that we think of kind of living in the south and the tropical areas, but it is very much in Oregon. We found that he was heartworm positive after a test, after he had some kind of consistent blood work abnormalities that kind of made us think about it. This speaks to the importance of people seeking preventative care for their animals. So there are monthly medications that dogs can be on to prevent heartworm disease. He wasn't on these, so he was left prone to heartworm. Now the happy pictures. So this is just about a month later on the left here when he reached 49 pounds. At this point, I think I called him a 3 or 4 out of 9 for BCS. You can still see his ribs, but he's filled out a lot more. You can see his cute little nub tail that he wound up with. And then on the other side there is, by February, he got to his happy weight. He kind of, until adoption, wound out between 55 and 60 pounds, and got his mobility back, he got his cute little pit bull bum back, and he did really, really well. He got adopted by a woman who had recently been through a lot of trauma of her own, and they kind of kept healing together. So this was a really, really happy story for us. A lot of these don't wind up super happy, so Duke was kind of a success story for us. Yeah, he's doing great. And that's it. Does anybody have any questions? Yeah.
Well, that was wicked. Early in your presentation, you mentioned the 5 freedoms.
Yeah.
And I was just curious if that was conceptual, or is there some evidentiary use for that? Has OHS, OVMA accepted that as a fact?
Yeah, it's pretty well accepted in the field. I think that it kind of goes back to neglect, that we're not meeting those basic needs for them. And I think a lot of people in the sheltering and rescue community know of the 5 freedoms, and it's something that we certainly strive to meet for all of our resident animals. So I think it would stand up because it really speaks to neglect, that if we're not meeting their mental and physical needs, then we're not helping them at all. Yeah. Yeah. Yeah.
With the kids like your guy here,
Yeah.
refeeding program,
Yeah.
what food are you using?
that's a great question. So if anyone couldn't hear, it was kind of with a refeeding plan, like do we recommend feeding dog food or cooked chicken or something like pure protein? It's a great question. We usually stick with dog food. Dog food is formulated to meet all of their needs. We generally use the bigger brands that have been kind of tested and been through diet trials. We don't want to feed them anything raw that might have bacteria. These animals are so weak and unable to protect themselves from a lot of different things that we want to kind of stay away from those. We usually, for this guy, I think we start out with a gentle GI diet. So a lot of companies will kind of make a gastrointestinal diet that's kind of meant to kind of be nice to their gut and be highly digestible. So for him, we start off with that because he was having a lot of bloody diarrhea as well. So we started off with that. We started feeding him about a quarter of his daily caloric needs, and then did that for a few days, and up to a half, and up to 3/4, and then onwards. So we usually just do a well-balanced commercial dog food to kind of feed them and help them get where they need to be. Yeah. Any other questions? Yeah.
Do you do necropsies for other agencies? We've had a couple done that we've sent to OHS,
Yeah.
just curious if you guys do that as well.
That we do right now. But yeah, do we? Great, we do. I just brought an animal. Yeah, I think Veronica's gonna go into a little bit more on that. Yeah.
Well, question on that, like you're talking about the necropsies and stuff. What's the typical time frame? Like I know we had an issue where we had a dog that was pretty much beat to death by its owner, but the DAs were kind of slow on the process of getting the dog somewhere to get a necropsy to prove. I mean, we were pretty confident what happened just based on the injuries, but we don't have a fridge. All we have is a freezer. So we stored the dog in the freezer for a day or two because they were trying to decide what they were going to do. They finally decided to send it to OSU to have the necropsy done to get more evidence against this person than what they did. What do you do in a situation? What do you recommend in a situation like that? I mean, that's all we have to store an animal. I mean, we have a freezer. That's it. Nowhere else is there to store it.
That's a tough one. With injuries like that, where we might not need like histopathology, which is like looking at that cycle level, freezing might be the best option. If it's left out, we're potentially inviting decomposition in to start sooner, which is really when we lose those soft tissue wounds. So something like that would likely have very obvious external wounds and that we can see inside, it's probably the better solution to put it in the freezer and not have it start decomposing sooner. Yeah.
I was wondering for shelter intake, doing a little more forensic style intake when an animal comes in. Do you recommend any sort of checklist or document that can kind of make it easy for everyone to follow?
Yeah, certainly. So at OHS we have a little intake exam, I'm sure you guys do too. And a lot of that actually can, although not specifically for forensic purposes, can be then used as part of a forensics exam, right? So like taking a temperature, a heart rate. If you don't have a stethoscope, you can feel a little femoral pulse and count that way. It's a good way to get a pulse. Absolutely, I think that's really, really helpful. And then it's really good that everything's consistent because people get into a rhythm, right? And start to recognize patterns. So I'm not really aware of any specific ones that are pre-made. We could certainly find some. The ASPCA or the HSPMA, the Humane Society of the United States, might have some too, might be kind of helpful for that. But yeah, absolutely. I think that's a great idea. Yeah.
Kind of backing on what he was saying. So is there a specific time frame for necropsies? Like if you put it in the fridge, how long before it's not going to be viable anymore?
Yeah. It's tough to say that. The sooner the better is definitely kind of a good rule of thumb, but we can definitely see what we can do at any point. It's hard to know for decomposition. It'll definitely be slower in a refrigerator, but it might happen faster in certain situations. So, we'll see it a little bit slower in a big animal with more body mass to break down. So that's a really annoyingly vague answer to your question, which is the sooner the better. But and truly, I think any necropsy is better than no necropsy. So even if we're not getting a ton of information from it, if it's kind of down the line a little bit, I think any information that we can get is better than nothing. So.
Just based off of my experience in this last week, and unfortunately having to meet Veronica up there at 8 p.m. and she was so amazing to be able to come back to OHS and meet me there because we had one that we weren't able to dig it up until 6 p.m. after getting a warrant and all that kind of stuff. I would be happy to look into using all the resources we now have and all the different agencies we're now getting involved with OACC. I'd be happy to look into trying to come up with some sort of transportation you know, whether it's a voluntary list or whether it's an interagency agreement, to be able to say, hey, you know, Coos County is a long ways away from Portland, and if they can bring it up to, let's say, me in Springfield, and so we're splitting that responsibility up a little bit, maintain chain of custody with, you know, people who know what they're doing and to get it up there. I think we can absolutely put something like that together to be able to have some sort of an email list or a text list or something along those lines. So something we can definitely work on going forward from here.
Yeah, great. All right, well, thank you so much, everyone, for letting me talk at you about veterinary forensics. Thank you so much.